Hello, everyone. My name is Liz Debut, and this recording is to serve as the musculoskeletal discussion post recording. In this recording, I will be playing both the advanced practice nurse and the patient. This clinical scenario is based on Joshua H., who is a 40-year-old male who comes in the clinic with complaints of right shoulder pain. The pain started 2 nights ago. The patient works as a welder and denies any other chronic medical conditions and feels that overall he is healthy. So let's start the patient interaction. Good morning, Joshua. My name is Liz, and I will be asking you some questions today and examining you. It's nice to meet you. Good morning. It's nice to meet you too. What brings you in today? I've been having pain in my right shoulder. Well, I'm sorry that you're experiencing pain in your right shoulder. When did this pain start? The pain started a couple nights ago. I see. What do you think caused this pain? Honestly, I don't know. Okay. What do you rate the pain at this current time on a scale of 1 to 10, with 10 being the highest? I'd say that right now it's a 4 out of 10. What would you rate the pain when it first started on a scale of 1 to 10, with 10 being the highest? When it first started, it was probably a 7 out of 10. Did this pain come on suddenly, or did it come on gradually? No, it started suddenly. Is your shoulder sore to the touch? Yeah, it's sore. The pain seems to be less now than when it first started. What makes the pain worse? The pain is worse when I use my arm a lot, like for shaving, cooking food, or when I work. What relieves the pain? I get relief when I rest my arm or when I take ibuprofen. Okay, I see. How much ibuprofen have you been taking? I've been taking 3 tablets about every 6 to 8 hours. Okay, what's the strength of each tablet? They're 200 milligrams each, so I'm taking 600 milligrams at a time. Has the ibuprofen been helping the pain? Yeah, it's been helping. Is the pain constant? Yes and no. It can be bad and then it can go to being less, but it's always there to some degree. Okay, I see. Have you done anything else to help the pain, such as ice or heat application? No, I thought about using some ice, but I never bothered with it. Okay. Are you taking any other medications for anything else? No, I don't take any other medicines. Okay. Well, thank you for clarifying your medication for me. Have you ever had this kind of pain before? No, this is the first time I've ever had this pain. Does your left shoulder hurt? No, not at all. Does your neck hurt? No, my neck doesn't hurt. Was there any swelling in your shoulder? No, ma'am, no swelling that I know of. Have you had any surgeries on your right shoulder? No surgeries. Have you experienced any numbness or tingling in your right shoulder? No, I haven't. Have you had any trauma to your right shoulder? No, no trauma or accidents. Do you have a family history of any musculoskeletal diseases or disorders? No, ma'am, not that I'm aware of. Joshua, what do you do for a living? I'm a welder. How long have you been a welder? I've been welding for over 10 years now. Okay. Are you right or left-handed? I'm right-handed. Have you had any other symptoms along with your pain, such as fever or chills? No fever and no chills. Have you had any nausea or vomiting? No, ma'am. No nausea or vomiting. Have you had any night sweats? Nope, no night sweats. Do you have a family history of bone cancer? Not that I know of. Do you have a family history of arthritis? No. Do you have any allergies to medications or environmental things like dust, pets, or pollen? No, I don't have any allergies. Have you ever been hospitalized? No, I've never been put in the hospital for anything. Do you drink alcohol? On occasion, I'll drink a few beers, maybe once a month, if that. Do you smoke cigarettes? No, ma'am. My wife would get me if I did that. Do you use recreational drugs? No, I don't, and I never have. How has this pain impacted your work and home life? Well, it's hard to do things around the house, and I've had to call off work yesterday and today. I'm sorry that the pain has affected you this way. Hopefully we will be able to get to the bottom of what is causing the pain so we can get you on your way to feeling better again. Do you exercise? I try to go jogging a couple times a week. Do you have help around the house when you need it? Yes, I do. My wife helps me when she comes in from work. Do you have any other health conditions? No, I don't. I feel healthy except for this pain in my right shoulder. Okay, Joshua, thank you for answering my questions. So those are the questions that I would ask the patient in relation to his injury. As far as testing for this patient, I would assess for the presence of the brachial pulse. I would also assess the pain and for the presence of paresthesia and look for pallor. Then I would inspect the shoulder with the patient appropriately draped for privacy. I would be inspecting the shoulder for contour and symmetry, skin markings, ecchymosis, redness, guarding, deformity, and discoloration. I would also encourage the patient to relax as I palpated the shoulder joints. I would be checking for tenderness, masses, crepitus, bony deformities, and lesions. I would also assess the capillary refill of the right hand, the temperature and the pulse in the right arm and the shoulder area. Next, I would assess the range of motion, both actively and passively, looking for crepitus and tenderness along the way. Finally, I would check for muscle strength in the shoulder and arm area bilaterally and grade the results on a scale of 0 to 5, with 5 being normal. My differential diagnoses include subacromial bursitis from overuse or rotator cuff tendinitis. The subacromial bursitis is a common cause of shoulder pain. It is an inflammatory condition that can be caused by repetitive overhead activities and overuse, subacromial impingement, crystal deposition, direct trauma, and infection, according to Faruqi and Rizvi 2022. And then with rotator cuff tendinitis, this is an inflammation of the tendons that make up the rotator cuff, which include the supraspinatus, the infraspinatus, teres minor, and subscapularis. This condition is often seen along with shoulder impingement and can present acutely following any injury or as a result of chronic repetitive overuse activities, according to Varicallo et al. 2022. And with the rotator cuff tendinitis, we could also do an x-ray to rule this condition out. Thank you for listening to my recording.